ఎక్కువగా ఏసీలో ఉండి వర్క్ చేస్తూ ఉంటాము. అండ్ అదొకటి. అండ్ హావింగ్ స్మోకింగ్ అనే అలవాటు ఉండటం వల్ల కూడా స్నోరింగ్ వచ్చే అవకాశం ఉంటుందా?
Yeah, AC one, I'm not sure, doesn't have a direct relation with the snoring, but yes, it may have allergic problem, asthma, these are increasing. For snoring, number one is if you have lot of fat in this area, especially the neck circumference, the tongue becomes thicker, automatically the airway becomes narrow. Number two is if somebody takes a lot of junk food, alcohol, doesn't do any exercise, slowly the muscle tonicity of these areas they reduce. So
Okay.
doing yoga, doing exercise, and doing some kind of it can be walking, badminton, some kind of sports activity improves the muscle tonicity, allows you to be in a good shape of body.
Okay.
That can prevent snoring. Other than this, there are some people who have polyp in the nose. This partition wall is deviated, bony bending, adenoid, big tonsil. That is a separate problem. They may not be fat, they may be physically active, but there is a problem in the nose or throat which is causing the narrowing. They need surgical cure. You need to remove that obstruction, make the passage clear for the air, and the snoring comes down.
ఓకే. సో, యూజువల్‌గా ఈ గురక అనే ప్రాబ్లము మగవారిలోనే ఎక్కువ ఉంటుంది అంటూ ఉంటారు. ఇది నిజమేనా? ఆడవారు కూడా ఎక్కువగా ప్రాబ్లమ్ ఫేస్ చేస్తూ ఉంటారా?
Men are more affected.
ఓకే.
But after menopause, when the menstruation stops, then middle-aged ladies like 50s, 60s, then the percentage increases. Till a lady is menstruating, we have a definite kind of hormonal balance that keeps the snoring away. When that hormone goes down, so after menopause, they become like the percentage increases like the male.
ఓకే. సో, ఈవెన్ హార్మోనల్ చేంజెస్ ఎఫెక్ట్ స్నోరింగ్.
Definitely. If you see in your family, you will see that maybe grandmother or aunties who are little elderly, they snore a little bit, who never had snoring previously in the lifetime. So after menopause, mild snoring can come.
ఓకే. సో, అసలు ఈ స్నోరింగ్ అనేది మనం డెఫినెట్‌గా స్నోరింగ్ వల్ల ఇబ్బంది పడుతున్నాము, డాక్టర్ దగ్గరికి వెళ్ళాలి అని ఎలా తెలుసుకోవాలి?
Correct. Number one thing is how you feel when you get up in the morning. If you feel fresh, your daytime energy level is good, probably that is not a bad snoring. But if you feel tired, even after spending 7-8 hours in the bed, you feel morning your head is spinning, something is wrong, you want to lie down again, or here and there you are falling asleep. The family members will tell you. Oh, suppose everybody is there, they're chatting, another person is dozing. Then you know there is something wrong. Number two is if you are a diabetic person, hypertensive person, along with that you have snoring, then you must mention that to your doctor.
Okay.
There are some other symptoms, like some people tell me I have excessive sweating at night, or I get lot of nightmares, or I have a fragmented sleep. They get up multiple times, go to washroom, and they feel dryness in the throat. These are all symptoms of obstructive sleep apnea.
ఓకే. సో, చిన్న పిల్లల్లో కూడా ఇలాంటి ప్రాబ్లమ్ ఉంటుందా డాక్టర్?
Yes, children also suffer from snoring, but their reason is different. Like adult, I told you sedentary lifestyle, obesity is major reason, whereas in children, big tonsil and big adenoid is most common reason for snoring. As you know, tonsils are there inside the throat, everybody knows that. Similar one structure is there behind the nose, where nose is ending and throat is starting. In that angle, there is a structure called adenoid.
Okay.
If the adenoid enlarges, then the airflow in the nose gets stuck. The air does not flow well. So there are a lot of kids who suffer from mouth breathing and snoring, which is absolutely not normal. That should be treated.